Welcome back to Fox 51 today. You know, insomnia can cause a lot of problems, a host of problems. But there's this new article out saying that it could actually lead to stroke.
Wow, sounds familiar with sleep disorders. They tend to lead to, some of those do, yeah.
Yes, here to explain to us more is Dr. Daniel Obesso with Trinity Mother Francis. Good morning.
Good morning.
Morning.
Well, now, you know, you are a sleep specialist, a doctor. You were telling us about this article during the break. I mean, that's pretty scary things to think that insomnia could possibly lead to stroke.
It is a scary thing. What this article actually found was that insomnia in younger populations, so 18 to 34, were 8 times more likely to have a stroke.
Wow.
Which is a high percentage.
Mm-hmm.
Well, what is it about, obviously, that's lack of sleep? I guess the inability, I know there's a technical definition for it, but the inability to sleep, what does that do to the body that would make it stroke prone?
So what they found is that people who, so for a technical definition is difficulty falling asleep or difficulty maintaining sleep. Mm-hmm. But they found that these people have increased blood sugars, which can lead to diabetes, increased blood pressure, so hypertension, and then also systemic inflammation, so inflammation of your blood vessels, all of which can increase your cause of stroke.
Well, now, if we get the feeling, or we show the signs of an insomniac, what are some of the treatments that you can provide to help us with that?
So the most important thing, or what we do as a society, is a lot of us have bad sleep hygiene, meaning we stay up too late watching TV, or on the computer, or on our cell phones, and that's really where it starts.
Well, obviously, I guess temporarily, can it be treated with some kind of sleep medication? What are your thoughts on that?
Yes, there are sleep medications that we can use. And the truth is, all of us will have situational insomnia. There are nights when we can't sleep.
Well, I definitely know that I've had that plenty of times. When is the point, though, of course everybody has the occasional night where they can't sleep, but when is the point where you're an insomniac?
Usually when it's lasted longer than a month is when you should start to seek medical attention.
Okay, a month.
Well, some of that, what would be, obviously, you other than the hygiene, you might have probably too many stimulants, maybe caffeine, or maybe those workout energy mixes. What else can cause this insomnia?
There are a lot of different things that can cause insomnia. Stress can cause it, depression, other medical conditions, so chronic pain, or people who have to wake up frequently to urinate.
Well, now at Trinity Mother Francis, with these sleeping problems, I'm sure you deal with a host of sleeping problems. What kind of studies and treatments do you offer over there?
There are a lot of things that we offer. We will do sleep studies. We'll do cognitive behavioral therapy where we talk to patients and find out what's causing their sleep problems.
Okay.
For those that may not know, and I've certainly been through on a sleep study, tell everybody at home what that's like or what you normally do in that situation.
Okay. So in a sleep study, what we normally do is we're going to put wires on your head that are monitoring your brain waves, wires on your chest that are monitoring your heart rhythm during sleep, and then some wires under your nose that we're monitoring your breathing during sleep. And then that gives us some information. One, we can tell if you're actually sleeping, and two, what's happening during sleep in the rest of your body.
Well, now, if we want to, maybe talk to you about some of our sleeping problems, where's a good place where we can find information?
The Trinity Mother Francis website is a great place to start.
All right. Well, thank you so much for stopping by this morning,
Appreciate
Doctor.
it.
All right. Thank you.
Coming up next year on